Good morning, everybody. My study is the practice on adult advanced life support and the influencing factors among the nursing officers working in teaching hospital Jaffna. Advanced life support. According to the European Resuscitation Council guideline, advanced life support is a set of life-saving protocols and skills that extend basic life support to further support the circulation and provide open airway and adequate ventilation. Advanced life support provided at the right time is essential for the improvement of mortality in medical emergencies such as cardiac arrest. Accurate knowledge and skills on advanced life support among all the nursing professionals is an essential part of nursing education and practice. Furthermore, it should be up-to-date with varying protocols. By this means, nursing professionals must be well prepared and confident to deal with medical emergencies. The need of this study is the cardiac arrest is the #1 cause of death not only in Sri Lanka, all over the world, and worldwide several studies were done in ALS. However, hardly any studies were done in Sri Lanka. Studies conducted among the healthcare professionals and students all over the world reported less satisfactory knowledge among the community. There is a need of initializing the concept and important to improve the quality and awareness among the nursing staff, and finally to identify the factors affecting their practice. The general objective, to assess the practice and factors influencing on adult advanced life support among the nursing officers working in teaching hospital Jaffna, and specific objectives are assess the practice on adult advanced life support among the nursing officers and to assess the influencing factors among the nursing officers. Methodology. It is a hospital-based cross-sectional study conducted in teaching hospital Jaffna from the period of November 2017 to December 2018, and the sample was collected. Data collection period from 1st of October to 31st of October 2018. The study population was all the nurses working in teaching hospital Jaffna. It was 419, and the nurses who were on long-term leave during the data collection were excluded. The sample size was calculated, and the calculated sample size was 380 with a non-respondent rate 10%. The total sample size was 480. Sampling technique. All the total needed sample size was 480, and the total number of nurses working in teaching hospital Jaffna were 490. Hence, all the nursing officers working in teaching hospital Jaffna were included in this study. A self-administered questionnaire with 3 parts were used to collect the data. Part A consists of socio-demographic data, and Part B consists of assess the level of practice, and Part C consists of affecting factors. Pre-test was done in base hospital Telipala among 10 nurses, and the questionnaire was modified accordingly. A self-administered questionnaire was used to collect the data, and subsequent visits were made to collect data from all the nurses. Data was analyzed with SPSS 23, and high-scale statistical tests were performed to identify the factors. Ethical permission was obtained from the coordinator nurse. The permission was obtained from the coordinator of nursing unit of allied health sciences and the head and dean of faculty of medicine. Ethical clearance was obtained from Ethical Review Committee, Faculty of Medicine, University of Jaffna. The permission for the pilot study was obtained from the medical superintendent based hospital Telipala. The permission for data collection was obtained from Director and Matron of Teaching Hospital Jaffna. Informed written consent was obtained from the participants, and participants were free to participate and withdraw from the study at any time. All the data were maintained confidently. So, self-administered questionnaire was given to 435 nurses. Among that, 338 nurses filled the questionnaire and returned. The respondent rate was 74.9. So when we go to the distribution of socio-demographic data, majority of the nurses falls under the age group of 27 to 30 years, and most of them were females. Their high educational level was diploma, and most of the nurses participated from other units, other special units, and their experience in current working unit was less than 1 year with majority of the nurses. So the distribution of in-service training, majority of the nurses didn't have in-service training on ALS or CPR, and the distribution of practice on ALS. So for the last 2 years of their service, about 38% of the nurses didn't attempt even one time in hospital cardiac arrest procedure. So there are several things that can be done by a nurse during a cardiac arrest. So this graph shows that the majority of the nurses participate in drug administration, chest compression and post-resuscitation care during the advanced life support procedure. However, they are reluctant to participate in recognition of deteriorating patient and defibrillation during the ALS procedures. So, when considering the questions that I wanted to mention, there are some questions and there are some findings that is important, that are monitoring the deteriorating patient is one of the most important part of nurses. However, there are 20% of nurses, they never participate in finding this deteriorating patient. And when an emergency situation arises, most of the nurses, although most of the nurses participate in active management, there are nurses, they always call the doctor and wait until his arrival. And when considering the leadership and other instructions during a cardiac arrest, most of the nurses practice that. About 28% of the nurses never practice this in their procedures. And I wanted to move fast as the time. These are the findings that I wanted to bring, but because of the time, I passed this. And this is the distribution of total practice score among the study population. This histogram shows that, and the right side skew, this histogram shows a big right side skewness, and the distribution of practice among the study population according to the practice category. When we consider the overall practice level, the good practice was distributed among 20% of the nurses, and average practice was distributed among 48%, and the practice inadequacy was there among 30% of the participants. Then, when consider the socio-demographic factors in relation to the practice on advanced life support, age, sex, and experience in current working place don't have an association. However, educational level and present working place have a significant association. When considering the significant, the educational level, with the higher educational level, the good practice was high, and the present, when considering the present working place, with the special emergency unit and other special unit, nurses has high knowledge level, so practice level. And next one, distribution of practice related to the advanced life support in service training. It also has significant association. Those who have went through the advanced life support in service training have achieved good practice. So, when considering the attempts to provide ALS with practice level, that's also significantly associated. So, this is the factors that we check under the personal factors. There are several factors I have arranged according to the p-value. So, the first, leadership skill, psychological issues and effective communication are mostly associated, significant. And the educational factors, motivation of the practitioner and learned or practiced with help of colleagues or co-workers, and training programs attended during the services have statistically significant. And when considering the hospital-related factors, ethical issues and insufficient emergency equipment have statistically significant. So according to this study, only 20.4% of the nurses have good practice, approximately half of the nurses had average practice, and the practice score was inadequate among 30.5% of the total study population. This study also demonstrated statistically significant relationship of several socio-demographic, educational, and personal hospital-related factors related to the practice on ALS. This study demonstrated that the majority of the nurses has adequate practice regarding ALS. Knowledge deficit and improper practice in several aspects of adult advanced life support among the nurses were found. The study also demonstrated the statistically significant relationship of several socio-demographic, educational, personal, and hospital-related factors. Further researches needed to be conducted in Jaffna teaching hospital as well as every other hospital in Sri Lanka to assess the knowledge and practice levels. Using a self-administered questionnaire to examine nurses' practice regarding the advanced life support, respondents might not indicate actual nursing practice. Lack of time as well as willingness of nurses for this study was big difficulty to carry out this study, so sensitivity and the specificity of this questionnaire have to check. The study was conducted in one teaching hospital. These findings may not be generalized to other teaching hospitals or other level hospitals. In-service training regarding the advanced life support should be given to all the nurses in continuous manner, provided updated information of evidence-based guidelines, continuous knowledge to understand the facts and improve the nurses' practice. Hospital policies and guidelines are necessary to improve the nurses' knowledge and practice on advanced life support. Further researches should be done in this field. The references are there.
So I think the time is up to stop there. Are there any questions, any comments on this presentation?
Study. Only one doubt I have that how did you categorize the practice score?
Yes, sir. The total score was 38 and we divided by 3.
You didn't use any reference? No.
Actually,
It's a good study, but you can improve. Actually, you are looking at standards. Your study was looking at standards of practice, right? So it's actually an audit. So you can call it an audit and then describe it as an audit, and then you'll get better results. Yeah, rather than describe it this way, consider it as an audit, look at the standard you want, and then compare it to whatever the factors that you studied. That will give you a better presentation. Anything else?